Today we're going to do Lipo AI, which is our device over here, and that's the background noise as that device is kind of cycling through its fan. But this device we've had almost 3 years now. We've had tremendous success with it. I love it for my office procedures. This is small amounts of liposuction. We've done it pretty much everywhere on the body. But the most common is under the chin. We have a lot of both men and women that want a better contour of their lower jawline, that getting rid of some fullness here all the way down to the upper part of the neck. And so we can now contour all the way back to the angle of the mandible, just under the ear and all the way to the other side, which we used to use, or I used to use, to straight liposuction in the surgery center. Now we can do it safely and actually better in this office using the Lipo AI. So as we look at Angie, as she pointed out, this is the area that she doesn't like. She's a little bit full here, and you can see she's got just a little bit of blunting of her mandibular angle here. And what we want to do is try to increase that angle so that she has a sharper demarcation of her lower jawline. So all she's going to have is a small 2 millimeter incision right there in the crease of her chin. I'm just going to kind of mark these. This is the main area where she has a little bit of fullness. And then we're going to go all the way back here, all the way down into the lower part of her chin area, upper part of her neck, and right along her jaw, all the way across. So all of this area in here is going to undergo the Lipo AI. And Lipo AI is basically laser lipo. It's a 1 millimeter fiber optic cable. We're going to use that to break up all the fatty tissue, melt some of it. Also, the nice thing is it heats the tissue. So when you heat the tissue, you get contraction of the tissue. So you get a really nice elevation of the skin and soft tissue that's left behind, really giving that improved contour that you don't get with straight liposuction. So I'm going to do that first, and that takes 10 or 15 minutes, and then through that same little incision, I'll use just a regular liposuction cannula, and we'll aspirate fatty tissue that's been basically melted or emulsified with laser lipo. And then that'll be it. We'll put some steri strips over this. It's just so small she doesn't even need a stitch. That heals pretty much without any marks. And then we'll use the steri strips for a few days, and we'll put her in a chin strap that she can take off tomorrow. She can shower and put that back on. And I have patients wearing that while they're at home and at night when they sleep for about the next 2 weeks, and then we'll see how everything's healing. Sometimes I'll have them just wear it when they sleep for another week after that. But you can go back to work almost immediately. We usually do these on Fridays, so patients can go back to work on Monday actually. And they do not have to wear the head strap while they're at work. They just wear it when they get home and through the night. So very little swelling, very little bruising with this, if any. We use a standard tumescent solution, just like I would in the operating room with standard liposuction. And you'll see me do all of that. And realistically, she really shouldn't have any discomfort while I'm doing this. If she does have some discomfort while I'm putting in the tumescent solution, because that can sometimes sting and burn a little bit, some patients it bothers, some patients it doesn't. We have this device in the background here called Pronox, which is a combination of nitrous gas and oxygen that this device mixes together. It's like laughing gas that you would get at a dental office. That works very well. So most people use it if they're going to use it while I'm putting in the tumescent, and then after that, you basically don't feel anything at all. Post-operatively, Motrin, Advil, Tylenol for pain. We haven't had anybody needing anything more than that for pain over the last 3 years.